Hi, Dr. Yass here. In this video, I am going to try to simplify two key concepts, which hopefully will help you understand why the Yass method can resolve your pain both in the acute stage and the chronic stage. It's not just for chronic pain. It will address all forms of pain upon getting the appropriate diagnosis. So the two concepts I want to discuss are what is acute pain and what is chronic pain. I am going to define what is acute pain, what is chronic pain. Acute pain occurs in more than 98% of cases based on my 30 years of treating pain because there is a force requirement for people to perform activities due to living in a gravitational environment. So to do anything other than just lay flat on the floor, you're going to have to push against gravity, which means the activity has a certain force requirement. Your muscles have to push against that gravitational force to allow you to perform the activity. So whatever the activity you're performing, whether with your arms or your legs, there is a gravitational push down, a force requirement, and ability of the muscles performing the activity to push up to allow you to perform that activity. If the force requirement of the activity is greater than the force output of your muscles, the muscles will strain and elicit pain. If the force requirement of the activity being performed is greater than the force output of the muscles trying to perform the activity, the muscles will strain and elicit pain. That is the primary reason for acute pain in roughly or greater than 98% of cases of people experiencing acute pain globally. What is chronic pain? Well defined, chronic pain is consistent pain of a time frame greater than 3 months. So if you've been having your acute pain for greater than 3 months, it is now considered chronic pain. Why do people have chronic pain? The answer is quite simply misdiagnosed acute pain. So the reason you have had your acute pain for a sustained period of time until which it is then considered chronic is because you never had the cause of your pain determined to be a result of the force output of your muscles being less than the force requirement of your activities. The reason is because everything I'm saying is not part of any aspect of the medical establishment, and force deficits do not show up on diagnostic tests like MRIs. So if you've attempted to have your pain, whether acute or chronic, treated through the medical establishment, the very, very highest probability is you're never going to get the right diagnosis, whether in the acute stage or the chronic stage. So quite simply, whether it's day one that you just developed your pain or some period 3 months thereafter until you get the right diagnosis, meaning understanding what tissue is in distress, eliciting that very symptom to create conscious awareness of the distress of the tissue, so an intervention can be performed to resolve the distress of this tissue, thereby ending its need to elicit the emergency signal of pain, thereby causing it to cease. Right? That's what you need, a proper diagnosis. You don't get the right diagnosis, you'll just have the same types of tissues that the medical system continues to find through diagnostic testing, get them treated, but if the tissue in distress is muscle, it's going to remain in distress because you're still going to try to live your life. You're still going to try to do the activities of daily living or other things that you're trying to accomplish. So again, I will very quickly define what is acute pain. The cause of acute pain in more than 98% of cases is that the force output of your muscles is less than the force requirement of your activities being performed. What is chronic pain? Pain that sustains greater than 3 months. Misdiagnosed acute pain. End of story. Okay? Hopefully you'll find this very, very helpful. It will begin to make sense. And you'll realize that whether you're on day 1 or day 10 years of pain, you need the Yass Method to get the proper diagnosis and the proper treatment. So if you think this video is helpful, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are added or when I'm live on YouTube. You just have to hit that bell icon to make sure you're getting your notifications. If you'd like to contact me by email, you can do so through Dr. Mitch at mitchellyass.com. If you would like to schedule a Yass Method session, if you want to get it in person in Jacksonville, Florida, you could do so. Or if you want to get it through Zoom virtually anywhere in the world, you could do that as well by clicking on the website, the link to www.livewithoutpains.com. There'll be a schedule now button. Click the button. You get to pick it and choose the day and time of your choice, and we'll be set. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.